Assalamu alaikum, the communication day. We have Mr. Adams, 67 years of age, has been in your care for the last 3 years. He was diagnosed with end-stage renal failure and is undergoing hemodialysis for 3 years. He is currently visiting the hospital twice a week. He is non-hypertensive and diabetic and is undergoing regular follow-up for his medical condition to the medical clinics. Recently, his diabetes and hypertensive has worsened. On the last visit, your consultant suspected that he might have ischemic heart disease and suggested a cardiology opinion. Today, he had another dialysis session, and after the session, he asked the nurse that he wants to talk to the duty doctor. Nurse told you that Mr. Adams seems depressed and is waiting for you in the room. Your task is to talk with Mr. Adams and address his concern. You are the senior house officer in the nephrology clinic. Okay, you will share the timer, then you can start.
Okay.
Ready?
Okay.
Here you go.
Yes.
Okay. Hello, I am Dr. Ghanem, Senior House Officer in the Nephrology Clinic. May I confirm that you are Mr. Adams, 67 years old?
Yes, doctor.
Okay, hello,
My
Mr.
name
Adam.
is Adam. I'm 67 years old. Hello, doctor.
Okay. I'm here to discuss issues related to your health condition. Is it okay with you?
Yes, I've been waiting for you, doctor.
Yes, Mr. Adam. Could you please tell me what you want to discuss with me?
Doctor, is this life? I've been coming here to the hospital for the last 3 years for the dialysis, and I know I have a lot of things: high blood pressure, diabetes, and now the doctor telling me I have to see the heart doctor. I can't live like this. Can you imagine life like this? This is very difficult for me. I don't want to come again.
Well, Mr. Adam, I'm so sorry for what you suffer, and I appreciate your concern, and I am here to help you. Um, uh, okay, I know that you are here in the hospital because you are doing dialysis. Uh, this is in the last 3 years, and also you are diabetic and hypertensive. Uh, I know yet you are suffering. Okay, but please could you tell me what your expectation about our meeting?
Hey, just let me go. I don't want to come here again. This is my expectation. I was waiting just they told me, I told them I'm not coming again. They told me just wait. The doctor will come to talk to you.
Oh,
Is there anything
yes,
that you can help me with?
yes, Mr.
Because
Adam.
I don't feel like I will come again here.
Yes, Mr. Adam. I really appreciate your concern, and I know what you're suffering. But your health condition is, um, I'm so sorry to tell you that it is deteriorating. And if you stop taking medication and stop doing this dialysis, this will make more deterioration and progression in your health condition. Are you with me?
Yeah, I'm with you, doctor. They are telling me like this, but
Yes, and
it's difficult for me.
I know this is difficult for you, but be sure we are here to help you and to offer all the help that you can to make your life better. And now there is a problem that you have may have a problem in your heart, which is ischemic heart disease. This chest pain and the symptoms that you have um, um, uh, can complicate your condition more. Are you with me?
Mhm. Yeah, I'm with you, doctor.
Do you know about your condition, your heart condition? Anyone talk to you about
Yeah,
this?
they told me I have to see a heart doctor, but I have been here coming to the hospital every time and doing this dialysis. This is not life. I don't want to live life. I don't want to. And now are telling me to see heart doctor.
Well, Mr. Adam,
Can you imagine? Do you know how many medications that I am taking? This
yes,
is not what I want.
yes, I appreciate your feeling, and I know what you are suffering. But the most important here is to keep your health and to take care of you, and to follow up your condition and prevent more deterioration. Um,
It's my health, it's my life.
okay. There is approach in our hospital. It is about the don't resuscitation approach.
Mhm.
Do you know about it?
Like, you mean like if my heart stopped, you don't want to do any
Yes,
heart massage or something like this?
yes, yes.
No, 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 no. I want full treatment. I'm not like someone who don't want to live. I love life.
Okay.
I don't want just to come every 2 weeks, every week, 3 times the hospital.
This is good. So why you don't know, want to take your treatment and leave the hospital?
Doctor, I have a lot of things to do. Just not coming to the hospital and taking and doing this dialysis. And now I see
Okay, but
I have to see the heart
how
doctor.
can you do this while your health is not good and your health is deteriorating?
I don't know, doctor. I'm not
How
sure.
if you want to do your life your daily activity and your work and everything that you are used to do, you have to take the medication and to do the dialysis and to follow the doctor's advices.
Mm. I've been
Are you with
following the
me?
doctor advice. Yes, I have been
Okay.
following the doctor advices for the last 3 years, and this is what I ended up with. Now they're telling me my blood pressure is not controlled, my sugar is not controlled, and they're telling me now I have to see heart doctor. I have been a good patient.
Okay. Um, okay. Okay. We have we can make like a group of doctor, a team of group of doctor that they could arrange a management plan that could be that could help you with your daily activity and make some arrangement about the medication and the dialysis session that could help you with your work and your social life. Is it okay with you?
Yeah, tell me about it. Tell
Okay.
me more about that.
Um, Okay, this group of doctor, including the kidney doctor and the heart doctor, also the gland doctor, a specialized nurse, and social and occupational services. This team can help you to make proper plan that could help you with your life and with your activity and your job.
Mm. So you're telling me there is another option?
Yes, they can make some arrangement that help you.
Mm.
Is it okay
Okay,
with
I will
you?
think about it. I will think about it, doctor. No problem.
Okay,
I will think.
okay, okay. Can I ask you some question?
Yes,
Okay. What do you do for living?
I used to work as a businessman.
Okay. And you told me that this condition is affecting your job,
Yes,
right?
it's affecting my job.
Okay.
Yes, I have to
Okay,
come
we will
every
take
time. I
this.
don't want to come.
Okay, we'll take this in consideration. Okay. And do you smoke?
Yes, I do.
2 minutes left.
Okay, smoking will affect your health very much, and I advise you to stop smoking, as it affects your heart and also your kidney status and your blood pressure. If you want, I can refer you to the smoking cessation clinic. Is it okay with you?
Yes, it's okay, doctor. Thank you.
Okay, and about alcohol?
No, I don't drink alcohol.
Okay. Okay, do you have any hobbies?
Yeah, I love to go swimming.
Okay, this could be arranged in the within the management plan, because this could be like an effort on your heart. So you would take medication and to do your hobbies whenever it is possible. Is it okay with you?
Okay, doctor.
Okay, and with whom you're living?
I live with my wife.
Okay, and are you financially supported?
Yes, doctor.
Okay, okay. Do you have any other concern?
No, if you are going to tell me about the options, maybe in another meeting, no problem.
Okay,
Thank you. Thank you very much.
okay. Thank you. Still
There's-
time?
Yeah, 30 second or 20 second. You want to ask about the job?
He is a
Ask about the job.
businessman. He is a
Yes, he asked
businessman. He
about.
told me. Yes.
Okay. Almost the time
Okay.
is up.
Okay.
10 second, 9, 8, 7, 6.
Okay.
Okay, time is up. Let's hear the comment from Dr. Muhammad. Then I will comment. Please, if you can prepare a comment, a case scenario, Dr. Sarah, for Dr. Muhammad, if you have.
I
Or
will try. I
yeah,
will try. No
there
ready
is
case.
no problem. There is a
Any
scenario
case,
in the
any
group
case.
before. Just sent 2 hours earlier. You can share it and you can do it about
Okay.
adalimumab. Okay, Dr. Muhammad, you can.
Okay. So I think generally this is the same approach everyone will do, but because it's a difficult scenario, and they are always saying that there is hidden agenda, but it is not about hidden agenda, and we are always have the misconception about that we should not discuss something that it is not written. So we'll be confused in the scenarios of communications always. We should not discuss this. We should not discuss this. It is not written here. We should not discuss it. But anyway, such scenario, I think there is in the line they said that address is concern. So it's open scenario to some extent. Like you cannot discuss something that's totally out of your limit. So this patient clearly he don't want to come to the hospital. He don't like hospitals. And so actually I did, when I did this scenario, I followed the same thing. I didn't do, I missed to do the exact points, which is, of course, you have to ask the patient why you don't want to come to the hospital. He telling you that I don't want, I am busy, I don't want to come to hospital. So the refusal of treatment is a case of refusal. So refusal of treatment scenario, we will ask why. And then, of course, we can involve the consultant. But before that, you have to offer alternatives. So offer alternatives straightforward. This patient don't want to come to the hospital to do dialysis. There is other options like peritoneal dialysis. There is other options like kidney transplantation. So these are the things that we should explore in such scenarios. The scenario, I think, also I don't know, but a little bit misleading. But we should be in this position for any refusal of treatment. We already know that we have to ask why, but the other thing that we should know, we keep it in our mind, we should offer alternative whenever possible. Whenever possible, whenever it is our capability to do that, just to offer the alternative. I think this is the main issue about this scenario. This should be the theme for any refusal of medication, the refusal of treatment, polypharmacy. You should offer, you should look exactly why the patient don't want to take this action, they want to take this medication, and then offer the alternative. If it's still refusing, this is this will be like you can offer DNR, you can offer consultant review, but you will not take the decision, you will not give the patient just he don't want. And then another thing about the depression, I actually explored the depression I mean, he is in depressed mood. Is he really understand what he is talking? Understand the information? He retains the information because this is decision about you can check the capacity of the patient. If he understands, he can retain the information. He looks like he's competent, but this is also. But the main issue is to ask why and offer alternatives. So in this scenario, I have been told like we have to discuss exactly the peritoneal dialysis, the procedure, even the consent. So if you don't want to go in details, you can just offer it. You have to offer, there is another option. And we usually peritoneal dialysis is not superior to the hemodialysis, but at least this is his option. He should know about it. We will not assume that of course, his depression has been on dialysis for 3 years. He should at least know about, he heard about peritoneal dialysis, kidney transplantation, anything. But in our discussion, we will not assume that he knows anything. We will still offer him. This is my only comment. Other than this, I think she followed the theme and she discussed with the patient, the introduction, the discussion. What else? The closure, which is good. Thank you.
Yeah, thank you, Dr. Mohammed, for the scenario. Nice
and
scenario,
from the
by the way.
beginning, I say kidney. I am a doctor in the kidney clinic, not nephrology.
Yeah, supposed to say that, yes, Dr. Sarah had a mistake while presenting herself to a patient. Unless he is the medical field, you have to say, I am Dr. Sarah or Dr. Ghanem or the doctor in the clinic today or the kidney clinic today or the kidney unit or whatever. But don't mention the jargon in the unit, I mean. So this is starting the comment. Anyway, nice scenario. Let me comment about the case. Nice scenario to be open scenario, as Dr. Muhammad said. You might face such vague scenario in the exam, and you will be stuck. You don't know what to do, what to say, what to ask, what to answer. You will go and just face whatever the patient will tell you. And according to his question, at the end of his question, you have to have answer for this question. How to do that? Just calm down, breathe smoothly, and wait for his question, and prepare some scheme or some point. You have to find a solution for his question. As Dr. Muhammad said, first of all, you have to ask him why. Any refusal or any patient refuse to receive medication or technique or dialysis or any procedure, ask him why you don't want. Because of what? Any social issue, any family issue, any maybe something in the hospital annoying him. He's not feeling comfortable in this hospital. You can say, what's in the hospital making you annoyed? Maybe he's depressed by the surrounding, the environment, the patient. Anything he can address to you, you have to find solution for that. For any reason. Maybe he will tell you, I'm feeling discomfort in this chair, for example, or this bed. Okay, we can change. We can put you in another view. You can see the garden or whatever. Just tell him what's discomforting him, why he's not feeling comfortable in this area, why he is not receiving this medication, why, according to the scenario. Whatever you feel the patient is not happy for something, you have to ask him why he's not feeling happy for that. So in this scenario, he doesn't like to be in the hospital. Okay, why? Why? What happened in the hospital? Anything missing? Anyone was annoying him? Maybe he's feeling the staff not respecting him. Maybe he's not feeling well with someone, neighbors, or whatever. So you have to explore by yourself why and prepare an answer for that. We can arrange, as Dr. Sarah said, we can arrange a meeting with our teams. They can sit with you to address your concern. This is at least some of the solutions, but this is not a specific solution for him. But if you feel like you don't have any solution, just offer a meeting. Okay, I can arrange a meeting with a group of doctor, with my consultant. He can convince you if you feel like you are losing the scenario and you don't have any solution. But regarding specifically to this scenario, he wants you to raise up an issue of peritoneal dialysis. Why? Because he can do it in the home, he can do it while doing his business work, and he will not visit the hospital. However, it's not effective as much as the hemodialysis. But still, it's one of the alternatives. So you can offer it for the renal transplant, as Dr. Muhammad said. Yeah, it's one of the options, but it takes time unless he has some volunteers from a living donor. If he has relative, so you can offer it. Yeah, we have also another option. If he's agree for peritoneal dialysis, okay. If not, you can tell him, yeah, we have another option which is less valid because we have a long list, waiting list for the cadaveric donor. However, if you have any relatives, your brother, your uh, family member, which is the first degree, they can donate you the kidney and you can live near normal life after doing some checkup and some blood test for you and for him to make sure that your kidney or his kidney can be living inside your body. This is the second alternative option you can do. Around both this option or solution, you can play the words and the questions about social support, about his job, about any support he need, who's living with him, who's taking care of him. That's it. Then the smoking, smoking and alcohol. And the option also by Dr. Sarah, it's nice one to mention the hobbies. Why? Because he's feeling depressed. So whenever you have low mood patient, just ask him about his hobbies. Do you have any hobbies? No. What about if you can go travel somewhere to change your mood, to go somewhere to do some exercise, to walk around? Any option, it might help him to get up or to get rid the depression from him, and he might have also some support from the community and population. This is the scenario, and before 2 minutes, you have to ask him, what's your concern, and address the concern. So it will be like this, as Dr. Sarah did in the introduction, then expectation, then the first thing after that, why you don't like to do the dialysis again. He will tell you why, then address the question or the concern of refusal. But again, if he insists and at till the end he's insisting not to do dialysis, so you can offer him a meeting with consultant. If he's still insisting, okay, this is his right. No one can force him for doing any procedure. Even it will help his life or it will make him living near normal life. He has the right to refuse anything. Yeah, a good thing also to warn him about his condition. It might worse your life. You will miss. You might suffer more if you don't do the dialysis. But again, it will not change his mind, and he is having the right to refuse totally anything because this is the autonomy for the patient. Okay, and again, after finishing all these things, if he's still insisting for refusal, tell him you have to sign a paper. But from my opinion, I mean, no need to mention DNR. Yes, why DNR? He's refusing to take medication. Why DNR? Unless he's
Uh,
admitted.
can I
If
ask?
he's admitted to the hospital, yes, I will
Okay,
let you know.
okay.
If he's admitted in the hospital, yes, DNR. Okay, we will not do heart heart massage. Sorry. Yes, we will not do heart massage whenever you are in the hospital and your heart stop beating. But for this scenario, why I will not do the massage? He is not visiting the hospital. He will be at home. This is my opinion again. But if you can you want to talk about your opinion, it's okay. Okay, well done,
Okay.
Dr. Sarah. In general, okay. Let's hear your
Okay.
comment. Yes.
Okay. When I read the scenario, I thought this patient wanting to end his life. He is like become not needing to any treatment, and he is trying to stop all medication and end his life. But when he told me why to do this, no, I want to live life. This was a plot twist that changed all the plan in my head. Second thing, I didn't know that peritoneal dialysis is optional. I think every type of dialysis has indication, and it is يعني it help a different kind of patient. I thought like this, so it didn't come to my mind that this is an option.
So,
Um,
Dr. Sarah, always the
okay.
scenarios repeated. Whenever you know the solution for the scenario, you'll never forget it. I mean, in this scenario, already you practice it. Okay. Whenever you hear this scenario from any other mentor or from any other colleague, you know what the scenario about. This is the communication scenarios in general. It's repeated, and every trick or every scenario has a trick. You know how to solve this trick. Okay, so this is the hidden agenda in this scenario. Patient refuse hemodialysis, so offer him peritoneal dialysis. And for some extent, you can talk about the transplantation. However, it's not immediate solution, but it might be in the future. This is the communication scenario. Every trick in every scenario, you have to know an answer, and you have to know a solution for it. This is how to pass the communication scenarios in basis. Okay?
Okay.
So it's okay not to know it now, but in the exam, you will know, definitely you will know how to address it. Better than sitting in front of the patient, you don't know what to say, and you just look at the patient, and the time is going, you don't know what to answer him or what to ask him. But you drive the scenario from the beginning till the end without stop. And this is also a good thing. At least offer the support, offer the team, offer the meeting, refusal. DNR, good option, but I don't think it's valid here because he's still alive, and he asks you, yes, I want to live. Why you want me to make me under this category? But anyway, don't be silent. You have to find some question to ask and some answers for his questions. This is the communication skills. It's a skills more than talk, like acting, how to find a solution, how to communicate, how to ask, how to answer. It's conversation, and you have to know the trick in every scenario and the hidden agenda, if not written. Sometimes the scenario is clear and straightforward, and you can drive the scenario easily by the questions and the scheme we are putting already. But if you didn't find, don't worry, just calm down, write some point you have to talk about, and just go inside. Start the conversation as introduction, the patient name, expectation. In this scenario, the scheme is refusal. So what you will do, ask him why. If he address, you can ask another question, another why, and why, and why, till you have the trick or the hidden agenda. In this scenario, he might reach to the level of transplantation. Doctor, I heard about transplantation. What's your opinion about that? Then you have to talk about transplantation by yourself. If you didn't offer it, they might explore it for you. Okay? But don't be quiet. You have to find the trick and the hidden agenda in the scenario.
Okay.
Okay? Clear now?
Okay. Okay.
You get a
Okay.
scenario for Dr. Muhammad?
Yes, I got the scenario
Can you
on the
share
group.
it?
On
Yes.
the group.
Yes, I agree with you. It's a difficult scenario, actually. I did the same thing. But you are right. Any refusal, we have to ask why specifically and listen to the patient. He's saying that I don't want to come to the hospital. I don't want to come to the hospital. Ask him why he don't want to come to the hospital. Maybe he's busy. He don't like the hospital. Like the same options, the same category of reasons. And then you can offer, for example, transportation. If you say, no, I don't like to come to the hospital, then you will understand that you can offer some alternative. But it is actually it's very difficult scenario. But in
Yes.
general, you have to understand that
Yes.
there are alternatives. Whenever the patient refusing, and you didn't find any reason, he say, okay, I don't have any reason to refuse. Tell him alternative.
Yes.
Same like what we're doing. If the patient he say I want to go from the hospital, okay, you can go from hospital. We can give you some tablets, take it at home, and
Yes,
then tell him
exactly.
about the result. So there is alternative. Always offer alternative.
Yeah, exactly. And sometimes in the scenario, they are writing the alternative. And your task will be how to offer this alternative in details. And of course, you have to have consent. So whenever you give option or give alternative, at the end of this, if he is agree, what do you think about that? How that makes sense for you? If he accepted, okay, so we have a form called consent form. You have to sign it. If he accepted this point, I mean. So always offer alternative, as Dr. Muhammad said. Alternative and why, alternative and why, until you reach to the convincing point for him, then consent it and close the scenario by the social support and the concerns. Okay, any other question, any comments? Dr. Muhammad, your scenario is here. I will read it for you.
Yes,
Mrs. Ann, 35 years lady, she had normal SVD of healthy son, diagnosed to have group B streptococcal based on isolation from vaginal swab. So it prevents child getting infection during delivery. And as part of standard treatment, he was given penicillin IV. On the third day of the mother reacted with the rash on the face and body. And on the fifth day, she was diagnosed to have Steven Johnson syndrome with multiple organs insufficiency involving the kidney and the liver, deranged liver function test and renal function test. Now she become confused, require ventilator for breathing. The team decided to shift the patient to ICU for possible intubation. The task, speak to her husband, explain the diagnosis, plan for management, and plan to shift her to ITU and possible intubation. So SVD, I think vaginal delivery, spontaneous vaginal delivery.
Yes, spontaneous
Yeah.
vaginal delivery.
Okay, you are the doctor in the medical ward. I will read the comment until you are ready. Yeah, someone asked about the mood. Why the mood, doctor? Yes, because it's written in the scenario. It seems he has depression. Any word in the scenario means something. You have to touch it in the discussion. So if written depression, you have to explore the depression. How, as Dr. Sarah did. Do you have any hobbies you can enjoy the life with? And you can, yes, say what's written here. Your life is precious for you, for others, for your kids, lovely persons. This is how to explore the depression. And at the end, offer the mood doctor. He will be in the team, he will follow you, and he will take care of you in this point. Because again, you are precious for us as well as for your family members and your lovely persons. This is how to speak about depression in any scenario. Okay, ask him why and explore the solution for the depression, like hobbies, support from others, social support, his family member. Remind him about the lovely person in his family, your wife, your kids. They need your help, they need your support. And at the end, offer the mood doctor. He might help you by giving you some medication or some talkative therapy or whatever. Okay, this is the way how to address the depression in any scenario. Okay, whenever you're
Okay, I'm
ready, Dr.
ready.
Muhammad, let us know. Yeah, let's reset the timer. Then
Hello, good evening. My name is Dr. Al Fadil. I'm one of the doctors here in the medical ward. Is this the husband of Miss Anne?
Yes, Dr. John. I am John.
Yeah, Mr. John. Mr. John, I'm here to discuss with you the health condition of your wife. Is that okay with you?
Okay, doctor.
Okay. Before we proceed, you want anyone with you here?
No, doctor, I came alone.
Okay. So, may I know how much do you know about her condition and you are aware of?
Yes, doctor, my wife came to the hospital for delivery, and after delivery, by 3 days, she has a problem in her skin. I don't know exactly what is it. And then they admit her, and she told me that she is deteriorating. Now I am concerned about her and my son also.
Well, yes, you are right. Where her condition is deteriorating. She actually, after delivery, she had an infection. She had a bug infection. And then we recognized that and we started some antibiotics. So after she got the antibiotics, she developed a condition called Steven Johnson syndrome. It's a medical term for a medical condition. Are you aware of this before? Have
No,
you heard
doctor,
about it?
what is this? No, no, what is it?
Okay, Mr. John. So it's like a reaction to the medications that sometimes happen. It affects the skin, and yes, it can affect the skin of the mouth and the skin, general skin. And so it will cause something like burn around the body, and the people who get that reaction will develop the condition will be very critical. This is why we put her in the close observation, and we would like
How is that?
to put her
How
in.
this happened? How this happened, doctor? Didn't you do this test before giving the antibiotic?
Mm, well, Mr. John, we usually do testing for anything that we are doing before giving the antibiotics. And I will assure you that this is not because we didn't do the test. This is
Okay,
unwanted,
that why
and we
is
are
that?
giving her the antibiotics. Yes,
Why
tell
is
me.
this happened?
Some people have side effects of medications. This is unwanted. We gave her the antibiotic on the best interest for her. Unfortunately, she developed this reaction. I'm very sorry to tell you that.
You mean this was not predictable?
Yes, it's not predictable. And
Okay,
let me just tell you more about her condition. Why we are concerned about her.
okay.
So after she developed the reaction, her condition gets very bad to an extent that it's affecting her kidneys, her liver. Like we have to keep close eye on her. Her condition is very critical at the moment. and we want actually to put her on a breathing machine.
Now you are telling me that she is more deteriorating and that even cannot breathe? What about my son?
Your son, to be honest, I didn't see your son, but we are the other family, the other team is taking care of your son. We are all concerned about your wife's condition now, and we're taking care of her. I am the one who are responsible for her condition. And for me, I want to tell you that our situations need to be, we need to put a tube down her throat, and to keep her on the breathing machine, and we will give her the support treatment that she needs. We will giving her the IV fluid, and we're giving her antibiotics. We give her the support management for the Stevens-Johnson syndrome. Our expectations is we are expecting that her condition will get better with close observation. But in some cases, it might not get better. I'm sorry to tell you that.
What do you mean, doctor? She could die?
And her condition, if not, she's potentially life-threatening. We will do all our best to help her. And we can only know after her response of the treatment. Her situation is very critical at the moment. Her kidney is and her liver is not working properly. We need your I want you to understand that, Mr. John.
Yeah, and what we are going to do now?
We are doing all our we're putting all our effort, and actually we're discussing with the intensive care team and all the other team, professional team, because her condition need care for multiple of the doctors in the hospital. We will keep an eye on her, and we will follow her in the coming days.
Okay, doctor.
Okay. May I ask you
Okay.
how whom your wife? How many kids do you have?
This is our first son.
Okay. And about you, how do you cope with this
Now,
with this situation? Yes.
now
Tell
the
me,
baby
what
still,
is your
now the baby still in hospital. I didn't get my baby till now, and they are giving him bottle feeding. They told me, and I don't know what will going on after that. And also, my wife is a teacher, and she need to go to work. Will she be able to go to work?
2 minutes left.
Well, as soon as she's getting better, she will definitely can get back to her normal life. Right now, her condition is serious. And I understand that you are concerned about your wife and your son. I'm sure I will going to discuss with the other team members to come to talk to you. May I know what is your major concern?
My baby. Now, my baby.
Okay. Okay.
And
All these
also,
things happen. Tell me,
I
what is
concerned about my wife. I concerned about she could
we can.
live or what could happen.
Mm, I'm sorry to tell you at this moment it is early to tell. It's early to determine what's going to happen. But we will do all our she will have the full support and all the professional consultation from our team. She will definitely get the best treatment. her condition will only be after after we monitor her response to the treatment. I'm sorry to tell you, I cannot give you the answer that you want. At this moment, it's early to tell.
Okay,
Do you
doctor,
have
I
any
will wait.
other concern?
No, no, doctor.
Okay. So if you want like to visit her, we will just discuss with the hospital policy, visiting policy, and I will let you to see her and see what comes.
Okay, doctor.
Thank you very much.
Okay, time is up. Let's hear the comment from Dr. Sarah. Then I will comment.
Okay. Well done, Dr. Muhammad. You did it well, but some notes about the case. Okay. First, you have to explain what is Stevens-Johnson syndrome and tell what is the definition of this condition, and tell that it is an unpredictable severe side effect of penicillin. And this sign and symptoms, including the skin, also the other organs like kidney and could be heart, could be other organ could be affected. So we talk about the signs and symptoms of the condition and also the complication, and the most serious one, which could be even death. Okay. After that, you have to talk. You told me that it was in the best interest of the mother and also the baby because of the infection in the birth canal. Okay. Now the baby, you could talk about him. We will take care of him in the hospital, and we will give you support by the social workers when you take the baby home. Okay. Also, we have to make a team, including the woman doctor or obstetrician, I mean, and the other doctors, nephrologist and skin doctor, all the doctor that could take care of the case, and also social and occupational work because she has a problem in work uh, for sick leave, giving her sick leave or whatever they need in her work. Okay. Um, and you answered the concern of the father. Okay, this is all what I want to say.
Yeah, thank you, Dr. Sarah. Nice scenario.
Thank you very much.
Yeah, well done, Dr. Muhammad. I will comment. But before commenting, I will ask you a question. What do you think this scenario about? What category of this scenario you can put?
Breaking bad news.
Exactly. So how to start it? You talk like
With
she's
the warning shot, yeah.
yes, warning shot and golden silence. You have to do all these things because she was going for normal spontaneous vaginal delivery and supposed to be fine. After couple of hours she will be at home, right, with her son. And
Yes.
instead of that, she's going to the ICU and she might die. How to do that with the patient? You have to do it preparing him and to give him morning shot, then the breaking bad news. Patient is going to ICU and she might die after a couple of hours if the patient condition didn't improve. So you have to follow the steps of breaking bad news. You did it. You said it, but you didn't do it.
Yes, you
Okay.
are right.
Yes, you have to prepare the patient. Yes, your wife came here, and don't repeat what he mentioned to you. He mentioned to you, my wife came to do a delivery, and I don't know what happened after that. You said, yes, your wife came to do delivery. Okay, why you are repeat? Don't repeat. Whenever he's saying, or after he stop, you can complete his sentence by another thing. Like, yes, he said to you, she came to here to put a baby and supposed to go home. And what's your expectation after that? I don't know, everything will be fine, doctor, and she might come with me to home. Yes, I appreciate your knowledge. I appreciate your concern. You have to appreciate always his concerns. Then unfortunately, I have some news which is not good as we hope. Then be quiet for a while. He will ask you why. What do you mean, doctor? Anything happen? Yeah, unfortunately, something happened to your wife after she took the medication, which is antibiotics in the best interest in her condition. You have to mention that. Otherwise, he will think that you give the medication by mistake. So, doctor, what happened? Tell me, doctor, what happened? Yeah, I'm afraid to say she developed a condition called Steven Johnson syndrome. What are you saying, doctor? What is that syndrome? Now you have to explain the condition. Yes, it's a severe complication or severe unwanted effect from the medication in the form of allergy. Or before that, you can say, have you ever heard about it? No, doctor, of course, no, I'm not a doctor. So you can explain now. It's a condition in which the medication given to your wife, antibiotics or antibug, that lead to some allergic reaction, some form of allergic reaction in the skin, in the kidney, even in the heart, sometimes also in the blood pressure, making the blood pressure low. And I'm afraid to say it might even affect her life. Oh my God, doctor, let him react. Then you can offer tissue or water, whatever. This is the introduction for any breaking bad news. And whenever you feel the scenario is breaking bad news, by the way, they will write for you breaking bad news in the task or category of the scenario. This is breaking bad news, so they will write for you breaking bad news. You have to follow these schemes, these steps. Okay, let's go back for the confidentiality. Someone asked if we can offer the invitation or invite someone to attend the meeting. So let's remember the rule of three. Okay, three. I mean what? Any scenario you have two person, you can offer a company. How? In this scenario, how many member in the scenario? They are two, right?
Husband and wife, yes.
Husband and wife. But the wife now already in coma, right?
Confused, yes.
Yeah, confused. So we broke the rule of three. I mean, you and the doctor and the patient and the wife. So the wife is lost. So you can invite someone else. صح? The wife competence or the capacity lost. She's in coma. So she lost the capacity. And this is breaking bad news. So you can invite someone to support him. He needs some support now. Who's this person? Whosoever, someone, maybe his brother or any family member, close member, I mean, close family member, not some friend or whatever. So you can do this whenever the third person lost his capacity. Let's assume the scenario by another way. If you have patient admitted with, for example, hepatotoxicity, but still he is awake, and you are talking to the mother, for example, the daughter came with suicidal attempt. No, suicidal attempt is something different. So it's the confidential from the start. Let's assume another scenario, for example, any reason, a patient admitted for any reason, okay? For any diagnosis, rheumatoid arthritis, for example, and you are going to break bad news for the disease or counsel about the disease, and you are talking to the husband, okay? The patient himself or herself is conscious, right? And you are talking to the husband about the wife condition. So you are three now, right? You can invite anyone else? No.
I don't think so.
Yes, exactly. So whenever the patient or the third party person is there, you can't invite. Make this rule for any scenario, except HIV and the suicide attempt. So any patient admitted in coma, and you are sitting with the wife, or already he's dead, and you are sitting with the husband. Okay, let's do another example. Patient admitted with brain death and already he's dead. And you are sitting to the son. You can invite or no? Already dead. And you will sit with the son.
Yes, you can
And
invite.
You can, you
exactly,
can.
you can. So this is the role of three. The third person lost, you can invite another person. But if the third person is still there or competent or his capacity is preserved, so don't invite anyone. This role I put myself, so you can follow or whatever. It's just opinion from my side. You can put it in any scenario except HIV and suicide attempt. But if you have another way to do, it's okay. Follow your approach. Don't stick to my approach. But I make it easier. If you feel there is a third person and he's intact, don't invite. But if he's not intact and healthy and lost his capacity, you can invite. Whatever the scenario, except HIV and suicidal attempt. Okay, let's go back to the Breaking Bad news. You finish the Breaking Bad news, then explain the condition, then the complication. Patient might die, and we are going to transfer the patient or your wife to the ICU. What is the ICU? It's a unit. Your wife will be monitored, observed closely, and we will get some sample for blood test, for image to be very close and following up closely. One question here, you might, or the examiner might fail you for your answer. Sorry for this, Dr. Muhammad, but take care of your words. You are in a movie and you have to act well. When she asks
Okay.
you, yeah, when she asks you, what about my baby? What's your answer? In the places, I think they will not accept this answer at all. You remember what was your answer?
I said I don't know. I'm not here. I'm not
Yeah,
following the
I,
bill.
to be honest, I didn't see your baby. Which is against any welfare. You are
Yeah,
not
yeah.
not reassuring him and you are depressing him. Why you came if you didn't see my baby? Why you are sitting with me? And all this we are agree this is and show a show, and you are there to act that you are doing care of the patient, you are doing good for the relative, you are supporting, you are, it's a show. So how to show the patient and the examiner good about the baby?
I will tell that
Yes,
the baby is taken care by the another team member.
yes, we are taking care of your baby. The concerned team taking care of your baby. He's fine. Everything is okay with him because he lost already the mother, and now he want to know about good about the son. And you came here to say no, even the son I didn't see him. So it's like two Breaking Bad news. So please act well. It's a show, and you have to act well with. How? Yes, I appreciate your concern. Don't worry, Mr. John. Your baby in good hands. They are taking care of him. Whenever you didn't see the baby or you don't know even about him, but you have to reassure him. You are here to reassure, not to depress the patient. Okay? He's already shocked with the wife's news. Now you give him another shock with the baby, which you didn't see and you don't know about him. This answer, don't do it with any scenario. Sorry, I wasn't there. I didn't know about your condition before. They will think that you are careless. You are not taking care by the words. You have to give good answer, even it's not the real one. Already, this scenario is show for you and for the exam because the patient is not patient. He's surrogate, right? So you have to act well.
Yes.
I appreciate your concern. Your baby in good hands. They are taking care of him. Don't worry. They are feeding him, and you will take him soon to home. Then, if he asks you at the end, as Dr. Sarah did, the concern was about the baby. I concern about the baby. Again, I can reassure you, your baby is okay. He's fine. They are taking care of him. However, if you want to take him home, if anyone of your family member can take care of him, we can provide you the baby. You can take him home. or to your relative or your family member who can take care of him. If you don't find, we can support your baby until you find that caregiver for your baby. Okay, this is how to answer by showing that you are caring even for the baby. Now let's go back to the wife. Doctor, will she die? What do you think about Steven Johnson if severe?
Her condition might lead to death. Yes, definitely. This patient, her kidney
Yes.
function not functioning, liver not functioning.
Yeah,
She's very
exactly.
critical.
It might
I think she will die.
exactly. Yeah. When she asks you clearly, will she die? You have to answer clearly also, will she die or no? You can say, I'm afraid to say, by some sympathy, of course. I'm afraid to say, this disease is very critical and some people might die because of this disease. Okay, you didn't point to the wife, but you answer his question clear, right?
Yes,
He
yes,
has to
very
know
good.
that. Maybe after a couple of hours, he will listen or he will hear the bad news about his wife lost. So be honest and give the truth, but use the sympathy way. This is I think the fourth or fifth concern in the scenario. So the possible question, I mean, then you can offer the support. Who's with you? Who's taking care? How many kids you have, as you did? Who's taking care of them? Do you need some support? But if she said no, this is first baby. Okay, don't worry. Your baby, again, reassure her. Your baby, him, your baby is fine, and we are taking care of him. And soon you can take him home if you find someone to take care of him. This is the way how to address before closing the scenario. Then you have 2 minutes. You can ask about the social again and the concern. Any concern, as Dr. Sarah said, the baby. So again, reassure, and you can give him the baby as soon as he has the person who can take care of him. Okay, this is my comment about the. But in general, you did great. Apart from the point of, to be honest, I didn't see your baby. Any scenario like this, don't assume that you were not there. There is also scenario starting antibiotics, or for example, for interstitial lung disease after starting methotrexate. And the patient will ask you, doctor, is this mistake by my GP? Don't tell him, I was not there, so I can't help you. No, you have to be sympathetic and empathetic. I'm so sorry what happened to you. Usually we are giving the instruction about the medication before starting it. However, maybe your GP was prescribing this medication for you in the best interest. Don't defend, and in the same time, don't leave him and just deny what happened with him. Okay. Anyway,
Okay.
before the end, Dr. Sarah and Dr. Muhammad, whenever you have 20 seconds, 30 seconds, offer some brochures, leaflets, website. In this scenario, you have to offer her or him the condition in website or leaflet or brochures. We will provide you some brochure about Stephen Johnson syndrome. You can read about it and to know more about this disease. And this is our contact number. You can call us whenever. There is one concern I missed. Why you didn't do the allergy test before starting this medication? We are not doing, I appreciate your knowledge, I appreciate your concern. Actually, we are not doing anymore this test. And this if unwanted effect might happen even if we do the allergy test. Anyway, we are not doing this test anymore. And it's few percentage of patients has this side effect. And I'm sorry to say it happened to your wife like this, okay?
Okay.
Yeah. Any other comment or any question from you, Dr. Muhammad, Dr. Sarah? Really, I like both scenarios. They are less frequent, but whenever you practice it, you will do it in perfect way. But the husband, there is comment from Dr. Abdullah, but the husband knows that his wife deteriorated. Surrogate said yes. So what's the problem? Deteriorated, but he doesn't know that she's going to be supported with breathing machine. She will be admitted to the ICU. They might be her life threatened by this condition. She might die. So it's breaking bad news. This is again, this is always my
this is
opinion.
very bad news.
Yeah. Yes, because she's going, and I said maybe after couples of hours she might have kidney failure, either dialysis, maybe heart failure, multi-organ failure. She might die. This is Stephen Johnson. They are considering this patient as burn, by the way, and you know the burn itself, mortality rate is high, especially if the surface area is large. The mortality will be more higher. Okay. By the way, don't worry if they wrote Stephen Johnson and ICU, the category of scenario will be written up, breaking bad news or whatever. So use the scheme for breaking bad news whenever you feel and whenever you see the word of breaking bad news. This is the good thing in the scenarios nowadays. They are putting the category of scenario. However, the scenario is long. It's like full page, written paragraphs. But at the end, they are writing the task, and in the beginning, they are writing the category of scenario. Okay. Any other question, comments? Hello, anyone
you
has
very
comments? Yeah, most welcome, Dr. Muhammad.
Thank
Be
you.
more sympathetic, Dr. Muhammad, please, in the
It's
practice.
very difficult.
No,
I
you
have
have to. Really, you have to.
I thought
They are
yes.
putting mark for every single thing, either adding mark or deducting the mark. So all the performance will be tested by these examiners, and you don't know what's your luck in the exam. You might sit with the stupid examiner. You might sit with the benign examiner. You don't know what's your luck. Okay, some examiner, they can consider that like you did great. On the other hand, other psychic and sick examiner, he might fail you for anything. This is the truth, believe me. Okay.
Yes.
Any other comments? Thank you, Dr. Sarah. Any other question from others? Any comment? Please feel free to ask any question, either by comment or writing or chatting or verbally.
أنا الرينال دكتور يعني جارجون زي النفرولوجي.
Yes. Nephrology, renal.
يعني قول
kidney only, yes. You
تمام.
can
طيب
with that.
لو قلت أوتوبسي بتاع الأوتوبسي المسؤول من مشكلة مخي بيجي ما بضرب حقة البوست مورتم اكزامينيشن
اوكي.
بتاع الأوتوبسي بيقول شنو؟ يعني دار أقول بتاع
سنيب
الأوتوبسي
سنيب
بتاع
حتى
الاوتوبسي بس مورتم. لا بتاع بس مورتم بتقولي انه the examiner medical examiner if you are talking
medical.
about biopsy snip but for autopsy post mortem examination no, you're talking about post mortem examination.
أيوة بوست مورتم أوتوبسي بتاع
post mortem medical examiner.
Yes, examination medical
examiner.
اوكي تمام.
But again, it's a snip. They are taking a snip from the body. Yeah.
Yes, biopsy is a snip. I think there is a file, there is a PDF file that's telling us about this jargon, all the terminology.
Okay, share it, please, Dr. Muhammad.
Yeah, I'll find. I think there is a good PDF telling all the jargon.
اوكي طيب باثولوجي دكتور يعني زول باثولوجيست حقول شنو؟ حقول سنيب دكتور هنا في الحالة دي بما انه حيشوف الخزعة حيشوف
No one mentioned pathologist in the whole basis scenarios. I don't know.
يعني
Yeah, okay, you can say
لا دكتور
the
الدكتور هو
doctor
specialized
who's
in it.
examining the snip. Always be simple.
Make it
Okay.
simple. Make it simple. Yes.
Yes, just be simple in the like you are talking to your friend, not in the medical field. This is how to talk in not in a jargon way. You are talking with your brother or your sister at home, or your friend is not doctor. Consider him like you are talking to him, and you will find the words in the simple way. Of course, you will not tell him, I have histopathology biopsy. So find the word you are talking to your friend, not medical friend, I mean, and do it in the communication. This is how to avoid jargons. And Dr. Muhammad also can provide you with the file. It might help you. Okay, Dr.
Yes,
Samah?
I will try to find it and will share it. Yes, inshallah.
انا عندي
Yeah, by
واحد
the way,
بس
it's
شديد ما حسيت بانه ممكن اقدر كتير، يعني انا هقعد افتش
no.
للسيمتوم كم صفحة. انا هبحث كيف
Dr.
طيب
Samah, it's
عشان
a matter, again, it's a matter of practice. Believe me, if you do
اوكي
jargon with scenario and someone corrected you, you will know this is a jargon, you will avoid it again. And you will learn from this.
اوكي
Okay, but
ان شاء
again,
الله
be simple as much as you can while presenting or explaining to the patient or surrogate. You will find everything easy. Don't make it complicated, okay?
ان شاء الله
Yes.
we'll try.
Or I want
Yani,
to ask
you
question,
are right,
please.
Dr. So you don't have to go all over the jargons, the details of all the jargons. There is common things that we are talking about: the neurology, the
Yes,
brain
exactly.
doctor, the kidney, the nephrology. And there is certain things that we are talking about. Yani, we are not going to tell everything about the jargon. Just little
Yes.
things, the little important things. You need to
Yes.
practice this.
اوكي طيب نيورولوجي هقول برين دكتور ولا هقول نيرف دكتور اور بوس؟
Can be both.
اوكي
If something in the brain, you can say brain doctor. If something in the nerve, you can say nerve doctor. According to the disease. Let's
مثلا
say
like
example
MS
for yeah, MS.
multiple
You can
sclerosis
say nerve doctor because mainly it's yes, something in the brain like
okay
ICH or hemorrhage. So you can say brain doctor. Okay.
Good evening,
Yes,
doctor. I want to ask question.
Yes, sure, doctor. Yeah. Go ahead.
If the surrogate tell me that I want to make a complaint, how
Yes.
I will guide him?
Yes, you can guide him. You can say, I will guide you to the office responsible for that. It's called PALS office, Patient Advice Liaison Services. Just that's it. I appreciate your concern. I will guide you to the office responsible for that. It's called PALS, Patient Advice Liaison Service. And you have to continue the sentence and be sure that even after your complaint, your care will not be affected by this complaint. You will get the maximum support and care you have to receive in our hospital. Okay, your care will not be affected by the complaint. It's like this, the answer will be like this. Starting by the guidance, then you can reassure him about the care will be provided, whatever, and regardless his complaint. Okay.
Okay, thank you.
Yeah, by the way, medical error, there is a lot of case scenarios in the exam about medical error. So you have to know the steps and the solution for the medical error in the exam, how to talk about and how to address the all concern and the steps of managing a medical error. A lot of errors in the exam. By any way, medication or procedure or harm, any complication, anything in the under category of medical error, the same extent and the same scheme. So don't worry, you will learn it one day. We can do it another day, maybe after tomorrow, with the communication. Okay. Dr. Muhammad, I guess he can do a case of medical error because it's very common, Dr. Muhammad. It might come to your exam.
Okay, inshallah.
Inshallah. Thank you for your question, Doctor. Any other question?
عندي
السلام
سؤال
عليكم
أخير
دكتور
الكيس
باسم.
الأخير حق البيشنت معلش بس البيشنت تحت النورمال فاجينال ديليفري ودخلوها الاي سي يو كده
Yes.
دي باعتبارها ميديكال ايرور
No, no,
اشتوها
no, no,
بنسلين
no,
ما
no,
عملوا لا
no, at all.
اها طيب
It's
نعتبرها
side effects. It's
طبيعية.
complication.
Yes. If this is medical error, they will mention that there is penicillin allergy. But Stevens-Johnson syndrome doesn't come from allergy.
It's like I
Okay.
didn't say allergy. It's allergy-like reaction, but it's not allergy. Yes, because
طيب
whenever
زي
you have
category.
taken medication and something happened after, it's like yeah, it seems like allergy, but it's not allergic in nature. Okay, especially it's like skin rash. Most of the allergy coming like skin rash, right? So it's like allergy, but it's not allergy. Yeah.
اوكي
Okay.
طيب شي كاتيجوري
Complication
اوكي
or side effect or complication.
Okay.
Okay. Thank you, Dr. Samah. Someone was asking, yes.
Doctor, just I have a question, but not related to this case. My question: if in the case scenario written, the patient is a doctor or nurse, do I need to avoid jargon also?
You can do whatever you want, but again, try to be as simple as you can. But still, they can accept the jargon because you are talking to. But you have to mention or to show the examiner that you know that you are talking to someone in the medical field. How? In the beginning of the scenario, for example, it's written, for example, Mrs. Lisa, and she's a nurse in your department. She had a needle stick. So when you introduce yourself, you can tell her, I'm Dr. X, I am the doctor here. We are talking, you are Mrs. Lisa, you are with us in this hospital, right? Yes, you are the nurse in the department. Yes, I am the one. So you showed the examiner that she is medical term, she is medical stuff, and she will understand most of your terms without mentioning jargons. Because no discussion with you, with the examiner. So you have to show that you are talking to the staff or the person who's doing or working in the medical field, and you are aware about that. So you can
Thank you,
say the
doctor.
jargon, but you are showing the examiner that I am intentionally saying the jargon because I know that she is a nurse in our hospital. So I introduce myself to her. I confirm that she's working with us in the hospital, and she will understand everything I am saying. Okay.
So nurses in the UK, normally they don't know the jargon unless it is nurse specialist. Because nowadays you're recruiting nursing just for sake of like nursing, cleaning the patient and so on. So they always come and ask you, what's this medical term? What's this medical term? So unless it's nurse specialist, they will be very educated. But normal nurses, they know
that's why I said try your best to be simple, but
exactly.
it's still accept. But it's the optimum to do non-jargon way. Even she's nurse, but still try to avoid the jargon. But if you are still you want to do, as I said, show the examiner that you are you know that you are talking to the medical staff or medical nurse or someone who can understand you in the medical terms. Yeah, accepted, Dr. Afak. Thank you. Any other comment? Any question?
Yeah, if I can add something for the previous case, like they already wrote in the first line the child in a good health, something like this in the first line. So she had a spontaneous vaginal delivery for a healthy child.
Yes.
Yeah. So I think we can make this point like to show the husband that like what we did was in the best interest of your wife, and to because normally your wife has certain bugs that can be transmitted to your baby and become seriously unwell. That's why we decided to give her these antibiotics.
Yes.
And I'm glad now your child in a very good health. As in the task, we are not adding anything.
Yeah.
So, yeah.
Yeah, very good.
Yes. And initially I said the medication given in the best interest, you have to mention this to the husband. Why he should know that this medication not giving by mistake. And as Dr. Afak said, yes, you have to specify also there was some medication given to prevent further infection. However, the medication was in the best interest for her condition, but the complication happens, which is then you can explain the Stevens-Johnson syndrome. Okay, thank you, Dr. Afak, for your comments.
Thank
Any
you
other
for
questions?
you. Thank you for you.
Okay, most welcome. Any other question, comment? Okay, if no more question, thank you all for sharing with me today and practicing. Dr. Sarah, Dr. Muhammad will end the session. Thank you. See you tomorrow, inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.